This segment is sponsored by Ohio Opioid Education Alliance. In the first 6 months of 2020, data shows that we saw a 73.4% increase in overdose fatalities in Franklin County alone. That means we've already surpassed the total number of overdose fatalities from all of last year, and there are still 2 months left. Obviously, these are troubling numbers, but Dr. Emily Kaufman from the Wexner Medical Center is here to give us her perspective and more information. Welcome, Dr. Kaufman.
Thank you.
So as a physician, what sort of impact are you seeing COVID-19 specifically have on this opioid epidemic?
Sure. Yes. Unfortunately, it has been devastating. It's been an evolution. Back in March, so looking back to early April, these were very strange times in all hospitals, not just here in Ohio, but across the nation. There was a stark downturn in visits to the emergency department where I work as a physician, as well as in the inpatient setting. It was quite drastic. We actually had a 55% decrease in visits to the emergency department and the hospital setting at that time. And unfortunately, that meant that a lot of people were relapsing at home from all substance use disorders, but particularly opioid use disorder. And unfortunately, many were relapsing alone. And we think that many, unfortunately, were dying. In the month of April alone, we had overdose death surges every single weekend in April. Anywhere from 5 to 12 people were dying each weekend. Then in the evolution going to May and up to present time, we've had an uptick in ED visits and hospitalizations as people are less fearful about coming to the hospital setting, as they were very fearful back in April of contracting coronavirus. But unfortunately now, due to the disparities in accessing healthcare and transportation, unemployment, evictions. We've now had many people who have a lot of anxiety and they've relapsed and they're using, and unfortunately many are dying.
It's so sad to hear. Now, there are tools out there like harm reduction tools that people can use to prevent overdose. And how can people access those?
Yeah, absolutely. I think, and there are many harm reduction tools, and the one I think that is the most important for the lay public to know is naloxone, or otherwise known as Narcan. It is one of the tools that can save a life, just like CPR can. It is something that we need to make as widely available as possible. The problem is that we've seen with people relapsing with opioid use disorders that many folks have been using alone. And to use alone, particularly if you've been in a state of recovery, is, unfortunate. It's akin to having a high risk of dying because you don't have the same tolerance that you had before when you were using, unfortunately, what the most common drug is used on the street is fentanyl. So naloxone is a medication you can get. It's widely available here in Franklin County. There are many sites that are called Project Dawn sites. OSU is actually a Project Dawn site. So you can go to either the James Pharmacy at the main campus or the East Pharmacy at the East Campus, or many pharmacies you can actually walk in and get naloxone. It's something you should always carry on you. Other harm reduction tips that I would give to all patients who struggle from opioid use disorder would be using and accessing safe syringes through SafePoint, would be taking medications for opioid use disorder, and that would be methadone or Suboxone, otherwise known as buprenorphine, and then accessing peer support services. These are folks in recovery who can help guide you throughout your recovery process to accessing treatments. And also getting vaccinated for hepatitis A and screening for HIV and hepatitis as well.
And how can someone not working in healthcare services make an impact to help those struggling with mental health and addiction, especially right now?
Yeah, absolutely. It's so very important. I think one of the take-home points about addiction is that it is a chronic brain disease. It's complex. It affects the brain's reward pathway. This is not a moralistic choice. So compassion and empathy for somebody struggling from opioid use disorder or any substance use disorder for that matter is of utmost importance. Reaching out to loved ones who may struggle from opioid use disorder, reaching out to them to make sure that they're okay, that they do not need any resources, and to create that empathy. It's very important. And carry Narcan. I'd say that's probably the third most important tip that you can do and help save a person's life.
Wow. Dr. Kaufman, this has been great information. And thank you so much, not only for joining us, but giving hope to our community when we need it most. Thank you so much.
Absolutely. Thank you. Take care.
For more information on fighting the opioid epidemic, you can visit don'tliveinDenial.org.